Welcome to the channel, The Nurse. Here we are discussing about infection control nursing, questions and answers. Please like and share this video with your friends. Please watch till the end and don't forget to subscribe this channel, The Nurse. Question starts now. First question. Cleaning of bed sore has to be done from inner to outer, outer to inner, near part to caregiver, none of these. Correct answer, outer to inner. Bed sore wound generally considered as infected or dirty wound. So cleaning will do from outer region to center. Next question. Infection occurred following treatment modality or procedure is known as iatrogenic infection, nosocomial infection, concurrent infection, fomite infection. Correct answer, iatrogenic infection. All hospital acquired infections are known as nosocomial infection. Concurrent infection means two or more forms of an infection existing simultaneously. Fomite means a non-living object or substance capable of carrying infectious organisms and hence transferring from one individual to another. Next question. While cleaning the eye, it has to be cleaned from inner canthus to outer canthus to inner canthus, middle of the eye to outer canthus, middle of the eye to inner canthus. Correct answer, inner canthus to outer canthus. Here is the example of direction, that is started from inner canthus to outer canthus. Next question. Immediate disinfection of all articles and bodily discharge during the course of disease is known as concurrent disinfection, terminal disinfection, sterilization, bactericidal. Correct answer, concurrent disinfection. Terminal disinfection means the application of disinfective measures after the patient has been removed by death, discharge, or has ceased to be a source of infection. Sterilization means the process of destruction of all microorganisms, including their spores. Bactericidal means the agents that kills the bacteria. Next question. What do you mean by cold sterilization? Sterilization under a temperature range of 1 to 80 degrees Celsius. Disinfection using disinfectant. Sterilization done under minus degree Celsius temperature. All of these. Correct answer, all of these. Cold sterilization is a general term used for all these options. Next question. Most important aspect of hand washing is time, type of soap, surface tension, friction. Correct answer is friction. Next question. Which of the following colored container must be used for discarding human anatomical waste in hospital? Yellow, red, blue, black. Correct answer is yellow. Red container is used for infected plastic waste such as catheters, syringes, IV tubings, bottles, etc. Blue container is used for all types of glass bottles and broken glass articles, outdated and discarded medicines. Black container is used for discarding general waste, food waste, etc. And it may slightly vary according to institutional policy. Next question. Yellow drainage from the wound is known as sanguineous, serous sanguineous, serous, purulent. Correct answer, purulent. Next question. The highest concentration of HIV virus is found in saliva, CSF, blood, semen. Correct answer, blood. Saliva, spit, urine and feces are not generally considered as infectious for HIV. Next question. Contact precautions are used in caring a patient with dengue, tetanus, pneumonia, MRSA. Correct answer, MRSA. Dengue fever is mosquito-borne disease, and tetanus, direct transfer of Clostridium tetani spores from soil and excreta of animals and humans to wounds and cuts. Pneumonia is transmitted through droplet transmission. Next question. Precautions used when caring for a rubella patient is droplet, contact, universal hand washing. Correct answer, droplet. Rubella mainly spread by infected persons' coughs or sneezing, that is droplet transmission. But it may also spread by direct contact with nasal or oral secretions. Next question. Which intervention is appropriate for a client with skeletal traction? Pin care, prone positioning, intermittent weights, 5-pound weight limit. Correct answer, pin care. Next question. Which type of precautions should the nurse implement for the client diagnosed with septic meningitis? Standard precaution, airborne precaution, contact precaution, droplet precaution. Correct answer is contact precaution. Next question. Under certain circumstances, the virus that causes chickenpox can also cause athlete's foot, herpes zoster, German measles, infectious hepatitis. Correct answer, herpes zoster. Next question. Strawberry spot vagina is seen in Candida, Trichomonas, cytomegalovirus, herpes simplex. Correct answer is Trichomonas. Next question. Hygiene is a word derived from Latin, Indian, Greek, French. Correct answer is Greek. Hygienic comes from the ancient Greek word hygeis, meaning healthy, or literally means living well. The state was represented by the goddess Hygeia, the embodiment of health and cleanliness. Next question. Carrier of a virulent organism is called host, monocarrier, pseudocarrier, agent. Correct answer, pseudocarrier. Next question. Best method of disinfection of hospital waste is fumigation, incineration, sunlight, burying. Correct answer is incineration. Incineration is a waste treatment process that involves the combustion of organic substances contained in waste materials. The apparatus or machine used for incineration is known as incinerator. Next question. Fungal infection of foot is also called as athlete's foots, gangrene, cellulitis, acne. Correct answer is athlete's foot. Gangrene means it refers to the death of the body tissue due to either a lack of blood supply or a serious bacterial infection. Cellulitis means it is a common infection of the skin and the soft tissue underneath. Acne means a skin condition that occurs when hair follicles plug with oil and dead skin cells, especially seen on face, shoulders, back, neck, chest, upper arms, etc. Next question. Malta fever is another name for Q fever, scrub fever, brucellosis, salmonellosis. Correct answer, brucellosis. Next question. Substance which kills infectious agent outside the body by natural, physical or chemical method is known as detergents, disinfectants, antiseptic, antibiotics. Correct answer, disinfectants. Detergents means a chemical agent in the form of powder or a liquid for removing dirt from the clothes or dishes. Antiseptic means the agent which prevents the growth of disease causing microorganism. Antibiotic means the drug which is used to treat bacterial infection. Next question. If a person has no resistance of the body, he gets the disease due to infection. This is called infestation, susceptibility, pathogenicity, none of these. Correct answer is susceptibility. Infestation means the disease caused by insects and worms, that means invasion of complex organisms. And pathogenicity means the ability of an organism to cause a disease. Next question. Which plasmodium causes malignant malaria? Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, Plasmodium malaria. Correct answer is Plasmodium falciparum. Next question. Mode of transmission of hepatitis E is waterborne, bloodborne, airborne, transplacental. Correct answer is waterborne. Hepatitis A and E are waterborne infections. Hepatitis B, C and D are bloodborne infections. Next question. Before blood transfusion, blood is screened for the following except malaria, hepatitis B, hepatitis A, HIV. Correct answer is hepatitis A. Before blood transfusion, blood is screened mandatory for HIV, hepatitis B and C, syphilis and malaria. Malarial parasite screening is recommended in endemic regions. Questions are here. Thank you for watching this video. Please like and share this video and don't forget to subscribe this channel, The Nurse. Thank you.